Hello all. So today we are talking about chapter 16, flexibility. We're continuing the conversation. This is part 2. So there are several methods that exist to improve flexibility and increase joint range of motion, and nearly all of them involve some form of stretching. Some examples of most of the types of stretching are presented in figures 16.2 through 16.4. There's quite a few pictures there. But stretches can be performed by the clients, which would be active stretching, where they're stretching themselves, or with the help of a fitness professional, which would be considered passive stretching. Although passive stretching can be very helpful for improving flexibility, it should only be performed by a fitness professional with adequate knowledge and experience to prevent injury to the client. There are generally 3 types of stretching that can be performed using active or passive techniques to improve flexibility. This is static, dynamic, and PNF, or proprio-neuromuscular facilitation. Table 16.1 provides an overview of the various types of stretching and their appropriate use. So static stretching is undoubtedly the method most commonly used to improve flexibility. Static stretching can be performed actively and passively and consists of slow movements into position and holding the position for a few seconds at peak tension. For example, to actively stretch the sternocleidomastoid or neck muscles, the client would perform a lateral flexion of the neck. As depicted in 16.4, this position would be held at a peak tension for 10 to 30 seconds before returning the head upright. You can add a little bit of tension to that to increase the stretch. Static stretches can be modified too, so that the client can better hold at peak tension or truly achieve peak tension via self-assistance and support. Furthermore, lateral flexion of the neck also serves as a good example of how static stretches can be passive stretches. Through careful movements, this personal trainer could also guide the client's head into position and hold at peak tension for a designated period. Despite the popularity of static stretching, little agreement has been reached among experts with respect to how long the static stretch should be held at peak tension. The American College of Sports Medicine suggests a hold range of 10 to 30 seconds. Data from Nelson and Bandy supports this recommendation when they conclude that static stretches of 30 seconds, 3 days a week for 6 weeks significantly improved hamstring flexibility in high school aged males than in unstretched controls. Interestingly, Sainz de Baranda and Ayala reported that no particular single duration, 15, 30, or 45 seconds of static stretching, was better with regard to its effect on range of motion. Thus, the fitness professional should advise his or her client to hold static stretches for 10 to 30 seconds. ACSM recommends stretches be repeated 2 to 4 times to accumulate a total of 60 seconds for each flexibility exercise. For example, if each stretch is held for 15 seconds, each would be repeated 4 times. And on the next slide, you'll see there are examples of static flexibility and stretches and training. So here you have a sample static flexibility training program for a 40-year-old woman who had been medically cleared to begin a consistent exercise program. She's about 5'6" in height and 150 pounds. She has no history of orthopedic problems, some mild chronic back pain. And the objectives are to improve flexibility as measured by goniometry, because that's the only true way you can measure flexibility. So the session consists of a 15-minute warm-up using a Nordic Track elliptical trainer, making sure her heart rate's about 108 beats per minute. And you can see the stretches that are lined out, beginning with the neck, then going to the shoulders, the chest, the arms, the back, the torso, and the hips. And then just making sure to follow the FitVP model. Dynamic stretching is a form of stretching that incorporates movement along with muscle tension development. Dynamic stretches should be performed only as active stretches. In the broadest sense, dynamic stretches are built into every mode of exercise and physical activity. Dynamic stretching has been characterized as being very similar to a sport or function-specific warm-up. The goal is to move the specific joint in a controlled manner within a normal range of motion in order to minimize the risk of injury. It is important to progressively introduce dynamic stretches into the stretching program, particularly if the client is not accustomed to this type of stretching. Dynamic stretches should begin gradually with a small range of motion, progressing to larger range of motion, repeating each activity 5 to 12 times. An example of this is arm circles. Begin with small, slow circles and gradually progress into large and faster circles until a full range of motion is reached for the shoulder joint. It is difficult to depict examples of dynamic stretching on paper. Consider the movements of a boxer in the ring prior to a fight. Jabs he makes with the upper extremities and quick turns of the torso all serve as good examples of dynamic stretch. Tae-bo movements and stereotypical medicine ball exercises provide further examples of dynamic stretching. Ideally, dynamic stretches incorporate movements that are specific to sport movements of interest, but excellent dynamic stretches can also be developed on the basis of the flexibility needs of the medically cleared population at large. And box 16.2 is going to provide an example of a dynamic flexibility stretch and training. Sometimes dynamic stretching is confused with another form of movement termed ballistic stretching. Ballistic stretching refers to the use of the momentum of the moving body segment to produce a bouncing or jerky movement that is done to obtain a peak muscle tension or stretch. For example, a client seated upright on the floor could extend his or her arms forward in an effort to reach the toes. By moving slowly into that position and holding for a few seconds at peak tension, the client would be performing an active static stretch. However, if an attempt to touch the toes, the client pushed forward repeatedly with short, successive bouncing flexions at the hip, he or she would be performing a ballistic stretch. Ballistic stretching is controversial. It has often been considered a contraindicated movement, but in fact, when performed properly, ballistic stretching may be done safely in adults, particularly in individuals who perform ballistic movements such as those found in basketball. Ballistic stretching can equally be effective as static stretching in increasing joint range of motion. Box 16.3 provides a discussion on the controversy regarding the use of ballistic stretching. And here you can see this is a sample of a dynamic range of motion training program. So you have a 25-year-old male that's been medically cleared to begin a consistent exercise program. He's about 6'3", 215 pounds, and there's no history of injury or orthopedic problems. His objectives are to improve sport performance and prevent injury through increasing joint range of motion and warming up prior to conditioning phase of the activity. So to do that, he's going to warm up for 5 minutes on the treadmill with an average heart rate of about 110 beats per minute. Then he's going to work with the shoulders first, do arm circles and shoulder shrugs, then move down to the hips and buttocks doing pendulum leg swings. You might consider pendulum leg swings as ballistic by nature. They are dynamic, but they also could be ballistic by nature to some degree. Quadriceps, the butt kicks, so taking heels to the rear, and then hamstrings, ankles, and then full body. Again, making sure to incorporate the FitVP model as you're with programming. So proprioceptive neuromuscular facilitation, or PNF, involves both active and passive techniques designed to improve joint range of motion. Several muscle groups can be trained when PNF techniques are properly used. This form of stretching requires an experienced fitness professional and a cooperative client. They really need good communication to be able to tell when the client is at the level that they can't go any further. PNF stretching should be performed only by competent and trained practitioners, as overstretching is possible if the technique is not fully understood. PNF techniques involve a dual process where an isometric contraction is followed. by a static stretch in the same muscle or tendon group. The contract and relax, for example. PNF stretching is commonly believed to elicit a relaxation response from the neuromuscular system. This response can occur in the primary mover or the agonist, the synergist, and antagonistic muscles across a particular joint. With a stretch-induced reduction in muscle tone, joint range of motion increases during subsequent stretches and eventually during physical activity. However, a review by Chalmers refutes this rationale and points to studies that suggest that PNF improves range of motion mainly because of changes in the ability to tolerate stretching and or changes in the viscoelastic properties of the stretched muscle. Although the mechanism for range of motion change with PNF continues to be studied, it is clear that PNF techniques have long been shown to increase joint range of motion. Despite the importance of full pain-free joint range of motion for sport and physical activity, the justification for certain flexibility techniques is controversial. Moreover, little scientific evidence exists to support either continuing or discontinuing even the most common stretching habits designed for injury prevention among competitive or recreational athletes. Not surprisingly, the personal trainer is bound to be confused with respect to the inclusion or omission of flexibility exercises in the overall conditioning of clients. One approach to this problem involves conducting a thorough fitness assessment of the client to determine the extent to which inflexibility limits sport and or general physical performance. Should range of motion deficiencies be evident in the client, then the personal trainer is justified in prescribing the basic stretching techniques described in this chapter. These stretches of static, dynamic, and PNF are most commonly known to improve flexibility. It is reasonable to employ these techniques and continue to monitor the flexibility needs of the client. Although at least one early study found significant improvements in flexibility with all three methods, fitness professionals are encouraged to select an approach that best suits the needs, the limitations, and abilities of the client while continuing to monitor joint range of motion and its ultimate impact on sport and physical activity performance. There are 3 preliminary training guidelines unique to the design of flexibility programs. These involve the warm-up, breathing, and posture. Although stretches can be performed at the start, in the middle, and or at the finish of the workout, it is common to precede stretching with a brief aerobic exercise warm-up. An active warm-up reduces the resistance to stretch. It has been established that increasing the temperature of a muscle increases the elastic properties or the ability to stretch. Warm muscle tissue responds less stiffly than cold muscle tissue. Little evidence suggests that the exercise warm-up should be altered to accommodate flexibility training exclusively. Typical warm-up exercises include a stationary cycling, treadmill walking or running, or rowing. It is often recommended that stretching be done at the end of the workout after the muscles are warm. Proper breathing techniques are often helpful in relaxing the client and allowing movement into position more comfortably. Flexibility training is no time to perform a Valsalva maneuver, which is air expiring against a closed glottis. Purposeful and controlled breathing that accompanies relaxing exercise may help reduce stress levels and decrease voluntary muscle tension. Remind exercisers to exhale slowly as they move toward the end point of a stretch and inhale as they return to the start position. In the design of a flexibility training program, fitness professionals should understand the proper positioning of the stretch to target the appropriate muscle group. Focus on maintaining proper body alignment during the execution of the exercises. For example, consider the stretch depicted in figure 16.2. Posture can be greatly improved by using the free hand, the hand not grasping the ankle, to hold a railing or the back of a chair to maintain balance. The personal trainer should emphasize that one should avoid pressing the elevated foot to the gluteals or hyperflexion at the knee, or leaning into the stretch for additional force development. Some reminders for correct postural alignment are listed in the following text. Maintain a neutral position of the spine, characterized by having a slight inward curve at the cervical and lumbar spines and a slight outward curve of the thoracic spine. Shoulders should remain back and away from the ears. Hips should be in a neutral and level position. There is little reason to avoid flexibility training in the apparently healthy individual. However, there are several common health conditions that require special attention and may present challenges to the personal trainer in regard to flexibility training. 4 of these conditions are arthritis, muscular imbalance, osteoporosis, and hip fracture and replacement. Chapter 20 provides specific guidelines about exercise programming for these special populations, but this section will present information to consider when designing flexibility training programs for individuals who may have these conditions. Over 50 million Americans suffer from arthritis or other joint pain and inflammation, with a higher prevalence found in women compared to men. Arthritis is believed to limit physical activity in both normal weight and obese adults. Arthritis is defined as an inflammation of a joint resulting in damage to the joint structure. There are more than 100 different types of arthritis, with the 2 most common types being osteoarthritis and rheumatoid arthritis. You have examples here, as you can see. The osteoarthritis there in the center and the rheumatoid arthritis on the right, with the normal depicted there on the left. Osteoarthritis is a chronic degenerative condition that develops over time and is believed to result from either abnormal or excessive wear on normal cartilage. Or rheumatoid arthritis is classified as an autoimmune disease in which the body attacks and destroys the joint surface. In either case, individuals with arthritis tend to limit movement because of pain and stiffness, which may result in an increased loss of flexibility and joint motion. Fortunately, flexibility and joint range can be improved in an individual with arthritis through training. In addition, training may assist in pain reduction, fatigue, and inflammation. Consider the following guidelines when flexibility training an individual with arthritis. You want to avoid strenuous exercise during acute flare-ups and periods of inflammation. However, it is important to gently move joints through their full range of motion during these periods. Encourage individuals with arthritis to stretch during the day, the time of day when pain is typically least severe or in conjunction with peak activity of pain medications. If the client experiences greater joint pain following a training session, the session may have been too intense and may need to be modified. Avoid overworking individuals who have taken anti-inflammatory medications such as aspirin, ibuprofen, and naproxen sodium. These drugs can temporarily lessen musculoskeletal pain and make it possible for a client to do too much. Discuss with clients the importance of wearing shoes that have good shock absorption and stability. Functional activities such as sit to stand and step-ups and stair climbing are good exercises that assist in ADLs, or activities of daily living. Many people have muscular imbalances of the body, which may create postural alignment issues and injury. Repetitive movements, poor posture, and weak or tight muscles can cause these muscular imbalances. Consider a baseball or tennis player who consistently trains and plays with joint dominance. When the body experiences an imbalance in muscular forces on opposite sides of a joint, range of motion of that joint may be affected. The obvious goal to correct the muscular imbalance would be to strengthen the weak muscles and stretch the shorter muscle if range of motion is compromised. Osteoporosis is a disease in which bone mineral density, or BMD, is reduced. Bone microarchitecture deteriorates and the bone becomes fragile and very susceptible to fracture. Osteoporosis afflicts more than 50% of the population aged 50 and older. Both men and women lose bone steadily after about age 35 years. However, at menopause, women often have an accelerated loss of bone due to hormonal change. The most common sites for bone loss include the spine, hips, and wrists. Flexibility exercises for those with osteopenia or low bone mass or diagnosed osteoporosis should be designed to minimize the chance for fracture. When possible, it may be helpful to have this client use a chair or handrail for support when needed. Examples of exercises to avoid include those that involve twisting, bending, or compression of the spine, or those that stress the wrists or hips. Specifically, avoid the following: bending forward, like the forward fold pose and yoga, supine spinal rotation or twists, plow pose, and back extension, the cobra pose. For individuals who have recently had a hip fracture or hip replacement, it is recommended to avoid flexibility exercises that involve excessive internal rotation of the hip, turning the foot inward, hip abduction, crossing the legs beyond the middle line, and hip flexion, where the thigh is more than parallel to the floor. And that ends our discussion for today. We will be picking this back up. We have one more section of chapter 16 that we'll be talking about. I look forward to talking with you soon. Have a great day.